Meli Orthopedics presents Post-Surgical Care and Therapy of the Shoulder. This video will provide an overview of what to expect following your shoulder arthroscopy. It will also include tips for your comfort and information about your first visit to physical therapy.
Hello, my name is Melanie Henderson and I'm a physical therapist working with Meli Orthopedics. We're here today to talk you through recovering from your shoulder surgery. There are several things we want to cover today, such as your dressing change, the care of your incisions post-surgically, your sling position, some early exercises, and how you can keep yourself most comfortable in that early post-op phase. When you come to physical therapy, please wear comfortable clothing. We will need to access your shoulder to remove your dressing, and you will need to be freed to move your arm. So tank tops, V-neck shirts, or button-down shirts seem to work best. When you arrive at physical therapy for your first appointment, you're going to have an ice pack on your shoulder, your arm is going to be positioned in a sling, and you're going to have a bulky dressing on your shoulder. With the ice pack, we'll take it off, but Dr. Meli really likes you to ice for the first 48 hours. You'll be to therapy by 48 to 72 hours. We'll take that ice off and give you further instruction at that time. Now, turning our attention to the sling position. The sling position should be horizontal. Your hand should be under the opposite chest. It shouldn't be slipped back, because that adds more strain to your shoulder. We like that sling in this position. Your dressing will be removed at that first visit. We'll take the dressing down, we'll clean the shoulder around the incisions and reduce you to 3 Band-Aids. You need to keep that dressing and that incision clean and dry until you come to physical therapy. We will then give you some instructions on how you can safely shower with that dressing on. The next thing we'd like to address with you is how you get comfortable after your shoulder surgery. Most patients find that lying down flat on their bed isn't very comfortable. That's generally because their elbow is well below the plane of their shoulder, and that exerts stress on the front of the shoulder. You can alleviate that easily by folding a towel and creating your own bolster to support the elbow and the lower arm such that the elbow and the shoulder are on the same plane. It's much more comfortable. Alternatively, you can sleep in a reclining chair the first night or two. When you get to therapy, we'll readdress these issues with you. You can expect in your first therapy session that you will have range of motion performed on your shoulder. One of our early concerns with shoulder surgery is that you'll get tight. So we will begin moving your arm on that first visit, and we want you to know that that's normal. We do that regardless of whether you've had a cuff repair or just a simple shoulder arthroscopy. Early range of motion after your shoulder surgery is imperative. We want to achieve full mobility as soon as possible. How much you come to physical therapy to achieve that depends upon the procedure that your physician performed with your shoulder. We will decide at that first physical therapy visit in consultation with your physician how many times we'll need to see you. That can vary anywhere from 2 to 3 times a week to a daily appointment for a short period of time. In all, I hope that this eases the anxiety that you may have as you contemplate shoulder surgery.
We hope that you have enjoyed this presentation. Please visit our website at www.paulmeli.com for more videos and information about your orthopedic care.